My name is Angelina Cumba, and I'm supply chain management expert. My role involved planning and improving the movement and storage of goods and services within the supply chain. And I began my career in logistics, where I managed procurement, shipping, warehouse, distribution, tracking, and reverse logistics, as well as I also ventured in business development. So I have also a good background in managing commercial. So over the past years, I've worked in various industries, including UN, mining, and oil and gas. And I'm specialized in creating project plans, strategies, and tools to make supply chain more efficient and effective. So I think is the way forward when it comes to effective supply chains within the health sector, basically. So regionalization is like where we are now adapting supply chain practice to better serve specific areas. For instance, for example, a company might set up several warehouses across country, and each warehouse serves as a different region, which helps ensure products are delivered more quickly. So that company can have warehouse in maybe example like north, east, west, south of the country. It can deliver medical supplies to local hospital faster than if everything comes into a single central warehouse. So when you look at the localization, so that is involved like really focusing in hiring and training local people to handle supply chain operations. So which means employing staff who are familiar with the local context. For example, a company can open a new distribution center in Mozambique or Kenya. It will hire local employees who knows the local customs regulation and geographical challenges. So this helps the company or the organization to operate more smoothly and comply with the local laws. And why this can be beneficial? Because number one, it improves responsiveness, like regional warehouse and local staff enable quicker response to the local needs, and also hiring local staff, working with the local suppliers, boost the local economic. And also lastly, I think it's very important also that the local staff understand and address regional specific challenges more effectively. Yes, I'm really very proud of the current organization that I'm working on, Village Reach. I'm particularly very proud with the Village Reach Outsourced Transport Resource Center project, which I lead. Is really focusing on developing local capability for managing public health sector and to replicate the best practice in other countries. So by collaborating closely with the local community, implementing partners, donors, it aims to improve efficiency and reliability of the health delivery. So this initiative highlights the importance of investing in the local talents to strengthen health supply chain. And there is a quote within Village Reach, like we are local driven and globally connected. So the local and driven and global connected is one of the Village's strategy that approach in the business within the supply chain management that benefits the local expertise and also the global resources. So when we say that we are locally driven, we are looking at the local aspect, like operation are managed locally by the people who understand the regional market, culture, and regulations. We have the community engagement in our strategy, in our plans, and we customize our service to tailor to meet the specific needs and preference of the local market or of the country. And we have a local response team that can quickly adapt to the change and respond to the local demand and issues. So when we are saying that we are global connected, which means that we have access to broad network of suppliers, technology, and best practice from around the world. So which means our innovation idea sharing, best practice are shared across different regions and markets. And these solutions, they are scalable. So the company or organization leverage the global scale, for the cost effective, and ensure that we streamline the logistics. And it's also very consistent, maintain consistent quality and standards across all regions. So ensure that our services, our strategies that, are globally, branded and have met the global needs. So that is exactly what we say, that, we are locally driven because we build local capacity, we use local experts, we engage the community, we customize our solution based on the needs and the challenges and priorities of the country. And we make sure that local team quickly adapt to those changes. And global connected, we have access to broader network of suppliers, network, and best practice, from the different world and different countries. Practice from around other countries in Sub-Sahara, because Village Reach is more focused in Sub-Sahara. And we share ideas and innovation and best practice across the different regions and markets. So that's what we say, that we are locally driven and globally connected. Yes, so I think the first thing that comes in my mind is really build the local capacity. What do we mean by that? Offering training programs that improve their skills in local workers. Partnership is very important. Don't invent the wheel. Work with the local organization, government to share resources and knowledge, and also explore the technology that fits the local context, to improve the operations. Identify the local suppliers, with the capacity, with the skills to make sure supply chain is more self-resilient. And also, I think most important is adaptation, adjust your strategy to fit the local culture and economic condition. Each and every country has specific needs, specific challenges, and specific requirements. So it's really very important that, your strategies can be fit, the local culture and economic conditions.